let's begin with just reviewing ways that we can lose heat, and be mindful that some of these also can be ways that we gain heat. And I think one of the more difficult ones to wrap your head around, just to go back from yesterday or to yesterday, was that heat loss through radiation. It's just our body emitting heat. And last night I gave a different analogy to the late afternoon class. And I said, have you ever sat next to someone, usually a male, because they're like furnaces, aren't they? You don't have to touch them. You can just be sitting next to them and you can feel the heat coming off of their body. That is heat loss through radiation, the infrared waves coming off their body. Another way you can think of that is if you were next to a wood-burning stove, not touching the stove, but standing next to it, you could feel heat coming off of that wood-burning stove. And that's part of the reason why I said it depends on the objects that are in the room. Clearly the shelves are not emitting heat, but if we had a wood-burning stove, it would. Does that help?
Yeah.
Okay. It was a great question. I just wanted...
It feels like it's radiating through the air by means of conduction of the molecules there. That's why I feel like that. But I guess, misunderstanding.
One follows the other. So on an exam, for example, I would say, what is the way that we lose most of our heat when we're sitting in a room? What is the way we lose heat? Radiative heat loss, right? But there are questions in your homework packet, for example. I think it's number 91, I think. And the question says, if a person is in an environment of high heat and high humidity, which of the following would be true, or something like that. And most of the answer choices are ways that they would lose heat. Then there's a nonsensical answer choice, like move to Florida or something like that.
Yeah.
Is it number 91?
It's 91, yeah.
Okay. And then if we stop and think about it, if they're in high heat and high humidity, they wouldn't necessarily be losing heat. They might be gaining heat. So we're going to practice more of those problems today, and hopefully we can start putting things in order. Just right now, what are the primary ways we lose heat? Okay, radiative heat loss. There is also conductive heat loss, where we are physically touching something. Most textbooks say it is a solid object, and we know better than that, don't we? It is not necessarily a solid object. Rather, we are physically touching something like air around us, water around us, but also the solid objects around you. Convective heat loss refers to these thermal currents of air. Warm air rises, and when it rises, it needs to be replaced by colder air. It's not like we have some void. Once the air rises, it disappears. There's nothing touching us anymore. That is nonsensical. Of course, colder air is going to replace it. Then we have to start this all over again. Evaporation is when water that is on the surface of our body is going from a liquid phase to a vapor phase. And in order for that to happen, there has to be a gradient, a driving force. If there isn't a lot of moisture in the air, say you go up to the mountains where it's typically very arid, and you feel your mucous membranes drying out because there isn't a lot of moisture in the air, then you would have even faster evaporation occurring if you were sweating during your hike. But if you were hiking through the Florida Everglades, where there's a lot of humidity, there's already a lot of moisture in the air, then the water would be less inclined to go from this liquid phase into a vapor phase because there's already water molecules there occupying that space. It's too crowded, if you want to think of it that way. When water does transition from this liquid phase to this gas phase, the remaining water molecules that are left behind are cooler. And that's another difficult concept to spin your head around. Here is one way to think about it. If I said, everyone, let's go to the Saddleback pool. I want all of us to jump in. I want you to take a lap down to the end of the pool and back as fast as you can swim. And I'm going to write down everybody's times. I'm going to calculate a class average. Once I have my class average, I'm going to ask the 10 fastest swimmers to please sit out. The rest of us will repeat. What will happen to our class average the second time? Will our class average be faster, slower, longer time? Okay, so think of the water molecules that are transitioning from liquid to the vapor as the fastest in the class. They escape. The remainder of the water molecules that are on the surface of your body, still in the liquid phase, now have less energy associated with them, less heat associated with them. And now you're cooler. You also remember me saying yesterday that sweating is just part of this. It's actually getting the liquid to go from the liquid phase to the vapor phase that cools us. And you are miserable, trust me, if all you do is sweat, but there is no evaporation. That means all the water is on you and it's not transitioning from one phase to the next. Are you okay? Did you find some of those questions in your homework packet that deal with temperature? Okay, and you're starting to understanding how I'm going to go after these a little bit. We'll work on more today as well. Now, when we're talking about thermoregulation, it has to be controlled. And yesterday you learned about our control mechanisms, our regulatory mechanisms. And there are two broad ways, either negative feedback or positive. Which one is associated with health most of the time? Negative. Okay, and so thermoregulation is in fact regulated through negative feedback mechanisms. There are 5 components that we need to this. It is part of a reflex arc. 5 components. They are, 1, you need something to sense your body temperature. You need Thermo Receptors. You have hot and you have cold. Then these receptors that are detecting temperature changes, they need the ability to send the information up to your brain. This information must be routed through afferent nerves. Afferent, that's not really how you say it. It's supposed to be afferent. But if I say afferent and efferent on a video, you probably won't pick up on the subtle difference in the pronunciation. So I'm going to say it wrong. Afferent, incoming, going to the brain, incoming information to the brain. So that's part 2. Part 3, you need integration. This entails using the brain and or spinal cord. This is where we have centers that can tally, collect the data, and then interpret it. The integrative center for thermoregulation is your hypothalamus. So the hypothalamus is going to tally all of this incoming data. And it's going to make a decision on what to do about it, if at all. If the hypothalamus says, wow, this body temperature is too cold compared to my set point, then the hypothalamus is going to make a decision that the body needs to warm up. It is too cold compared to set point. That means that the hypothalamus now has to send an outgoing command. This is step 4. The outgoing command has to go through nerves, efferent, outgoing nerves. And then the 5th component means that you have to have effectors, something in the body that can warm the body up. For example, skeletal muscle. Skeletal muscle can start to contract, shivering, if you will, and that generates heat as a byproduct when the muscle is contracting. So the 5 components again. You need a sensor, some sort of receptor that can detect change. 2, you need afferent fibers. 3, you need integration. You need some sort of command center that is getting all the information and making a plan if necessary to adjust. 4, the command needs to be carried through outgoing nerve fibers. And then 5, you need to have effectors, something in the body that can finish off the command, perform the command. Good? Okay. Yes?
Did you say the skeletal muscles make the body shiver and then it causes heat?
In my example, when I said that our body temperature was colder than the set point, then the outgoing command would be from the hypothalamus to warm the body. One example of an effector that can warm up the body would be skeletal muscle. Yes. We're going to go through more examples of effectors in just a moment. Now, let's talk about thermoreceptors and where you find them and what kinds there are. You heard me say that there are heat thermoreceptors and cold. Fact, you find these throughout the dermis of your skin, both hot and cold. You also find them in a certain area of the hypothalamus. Isn't it weird to think that the hypothalamus can be both an area where you have sensors and an area where it's integration? And yes, it can be both, but just different places of the hypothalamus. For such a little thing, it's very compartmentalized. Now, here's the thing. We find both of these receptors in both places, but we need to tweeze out more truth a little bit. The receptors that are found in your skin, those are called peripheral thermoreceptors. They're peripheral. The ones that are found in the hypothalamus are called your central thermoreceptors. Now, predominantly, the peripheral thermoreceptors are monitoring changes with respect to coldness. I didn't say exclusively, I said predominantly. Predominantly, the thermoreceptors that are in your hypothalamus, they are monitoring changes in warmth. I didn't say exclusively, I said predominantly. And the reason why I'm telling you this is because when we start to talk about fever in just a moment, one of the ways we can help fever is by putting someone in a lukewarm bath. That temperature actually is important because if you put someone in a cold bath, you can actually make things worse for them. And I'll explain how in just a moment. Stephen.
No, experience.
Okay. You could make things worse for them. So that's the reason why I'm telling you about the predominance of some of these thermoreceptors in a certain place over others. It does have clinical importance. By the way, that is one of your tutors. That's Cole. he says in a very shy voice, which is not like him. Are you going to put your tutoring times up on the board? Once you find out for sure which ones you're going to keep?
I have an idea of what I'm going to keep. I'll just email them.
Okay, perfect. Okay. Anyway, he is our embedded tutor. That means he actually will come to our class from time to time just to be another person in the room that can hear and help us with lab when we actually start doing things. It's just nice to have another set of hands to help out. So, speaking of effectors, besides skeletal muscle, another effector that is oftentimes dismissed are capillary beds found in the dermis of your skin. These are not voluntary. You cannot control how much blood is moving through those capillary beds or not at any given time. Understand, though, that if you have vasodilation of the upstream arteriole, you will get more blood going to those capillary beds. That means more heat can go from your blood through your skin to the air around you, or water if you were submerged. And you would be able to lose more heat. If you were cold, your upstream arterioles can vasoconstrict, and this would reduce the amount of blood that are going to these capillaries. You would then reduce the amount of heat that you would be losing through your skin to the surrounding environment around you. The vasodilation and vasoconstriction, regulating how much blood goes to these capillary beds or not, can impact your body temperature about 8-fold. Do not dismiss them. They are very important effectors. Very important. You just don't have control over them. So let's say you are too warm. How can you cool down? How can you decrease your body temperature? What could you do? You could get real big. You sprawl. You also don't even want to move. Have you ever found yourself on a very hot summer day, sprawling on the couch, and someone saying, let's go do something? Dude, it's too hot to even move. Parents out there, it's too hot to cook. That's code for you can't even be bothered to move. It's too hot to move. Knowing that every time you move, that requires muscle contraction, and that means more heat production as a side product. So you don't want to move. You want to sprawl. And that's to increase the surface area of your body that is exposed to the environment. You are trying to augment how much heat you can lose through conductive and convective heat losses. Expose more of your surface area to the air around you. What else could you do? Should you shiver? Would shivering cool you? No. So again, you don't want to move. What else would you want to do? Would you want to sweat? If you sweat, that means you get water on your surface, and if the conditions permit, that could lead to evaporation, right? About 20%-ish of the heat we can lose can be through evaporation. So you would want to sweat, hoping that it leads to evaporation. You'd want to be still, and you'd want to sprawl. Any others? What about the ones that I just said? Don't forget about them. Would you want to get more blood flow to the surface of your body to augment how much heat you can release to the environment? You would. So you want vasodilation. And remember that when you're hot, don't you look flushed? Yeah, and that's because your arterioles are vasodilating and trying to get more blood to your skin capillary beds so you can radiate and conduct more heat away. What about if you are too cold and you need to warm up? What could you do? You shiver. You definitely want to move because muscle contraction, one of the byproducts is heat production. Would you want to be big or would you want to be small? Small reduces the amount of your surface area that is exposed to the environment. You might also go and put on some layers of clothing. Would you want to sweat? No. Would you want to have your upstream arterioles vasodilate or vasoconstrict? Constrict, because you now don't want to bring as much blood to your dermal capillary beds. And that's part of the reason why when you're cold, you look pale. Everything is vasoconstricted. Something else can also kick in that we'll learn about in a future class, and this is the thermogenesis that can occur with thyroid hormone augmentation. So the thyroid hormone can also lead to more heat production. We'll talk about that in a future class, either this week or next week. And we'll tie that in because people who have thyroid disorders where they have too much thyroid hormone, they always complain of being too hot. They feel too hot. And that's part of the thyroid hormone mucking with their mitochondria and leading to more heat production. And we'll talk about that in the future. So it's up on the slide. I just wanted to briefly tease you with that little carrot. Do not memorize this chart. Do not. You don't need to. I'd like to think it has a lot of common sense. If you get too hot or if you get too cold, what could happen to you? Yes, go ahead, say it. You can die. That means your environment can outmatch your body's ability to thermoregulate. Everything within reason, right? That's what we frequently say throughout our day, within reason. If you put yourself in an environment that is very cold or very hot, and you cannot warm up enough or you cannot cool off enough, you will be outmatched by your environment and you can die. Before you die, you will experience organ failure, you will have confusion, and we'll talk about some of the signs and symptoms of hypothermia and hyperthermia. Does everyone know that in a clinical setting, they frequently will talk about S and S's? In a clinical setting, they like to abbreviate everything. S and S's stands for signs and symptoms. A sign is something you can see in your patient without them communicating to you at all. You can just look at them and go, oh, I see this. A symptom is something that your patient must communicate to you, tell you about. For example, I might be able to look at Cole, and if I saw dark circles under his eyes, puffiness, I might say to him, "You look tired." And Cole might say, "Yes, I'm tired." That's true. But I would not be able to look at him and make a statement about how early he went to bed last night, how well he slept. I would not be able to look at him and make a statement about that. Well, clearly you stayed up too late. He might say, "No, I actually went to bed at 8 o'clock. It's just that I had a lot of bad dreams. I couldn't stay asleep." He'd have to tell me about that. I couldn't just look at him and know what happened to cause his sleepiness. Does that make sense? Signs versus symptoms. Okay. So here is a question to you, and it goes very much along with that question number 91 in your homework packet. How would you lose heat? Notice the emphasis. A net loss of heat from your body. If your environmental temperature is greater than your body temperature. I'll say it again differently. How would you lose heat if your environment is warmer than what you are? Yes. So would your body try to cool you off? That's true. But I didn't ask that. I said, what would be the net loss of heat? And you wouldn't. You'd gain heat. You're losing that match. And I'll put you in some real scenarios that I bet many of you have been in. Let's pick the hot tub. How many of you like to go to ski resorts in the winter? You go skiing or you go snowboarding, and at the end of your snowboarding skiing day, you're sore, you want to go out to the hot tub. A lot of these resorts have hot tubs outside, so that you can sit in the hot tub and look at the beautiful mountains that are snow-capped around you. When you go out there, you've got 14 layers on. You have to walk out through the snow to get to that hot tub. Probably adult beverages are involved. You get in the hot tub, you sit in there for about 15 minutes. And what do you say? How long do you stay in there? Eventually you start saying something like, I gotta get out, I'm getting too hot. Don't you say something like that? Unless, of course, the adult beverages have been in great quantity, in which case your hypothalamus is now going to sleep on you and is not helping to regulate you. But that's a different issue. Eventually, you start saying, I am getting hot. I need to get out. You even start pushing yourself out of the water a little bit, putting your arms out, trying to cool off a bit before you get out. But when you get out, you pick up all your 14 layers of clothing and you're walking back to your condo or wherever you're going in your bathing suit, no layers on. And you're like, isn't this a nice night? What happened? Did you lose heat? Oh, for sure you were sweating on your face. You had radiative heat loss through the crown of your head, but you don't have radiation heat loss for being underwater. Did you know that? Doesn't happen. Doesn't happen. No. So you weren't having a net loss of heat. You were gaining heat from your environment. Similar situation with a sauna. You go in this hot box. The steam is coming off of the hot rocks. It's moist in there. You start to sweat for sure, but is there evaporation? Nope, because it's so humid in there, isn't it? So you are gaining heat again. And eventually you say, I gotta get out of here. I'm starting to cook. Yeah, you are. You don't have to be in a sauna or a jacuzzi. You could just be out on a trail somewhere. Out in Death Valley, there's a reason why they call it that. Hot summer day. And yeah, you have some water. Oh, you're sweating. It's desert out there. You're evaporating. But you're not having a net loss of heat. You're gaining heat. You're having more radiation warm you up from the sun and the surrounding rocks that are emitting heat as well. You are outmatched. You're going to start to have hyperthermia. You will show signs and symptoms of hyperthermia. Keep it up. You will not be able to compensate and you will die. People do this all the time. They do not pay attention to their body going, hello, getting too warm, need to do something else, get out of this. Or too cold, need to get out of this. Well, we've done hyperthermia. What would we see? What are the usual causes? We say in my pathophys class, what are the usual suspects? Go after the usual suspects. Question.
Does that situation work the other way around as well, where if you're too cold, there won't be a net gain of heat?
If you are too cold,
Like if you're
you can't generate enough heat to keep your body temperature in normal range. Yes, that's called hypothermia. Yes, there's death on either extreme, absolutely. Hyperthermia, the usual suspects. You've been exposed to an environment that has outmatched your cooling ability. You could not have a net loss of heat. What would you look like? You're going to start to have organ failure. Your kidneys will not be able to filter your plasma. Rhabdomyolysis is one of my favorite things to talk about. That's a fancy way of saying your skeletal muscle cells start to lyse. They just rupture. And that is a very abundant cell in your body, not because of quantity, but because of size. And when your skeletal muscles start to lyse, out comes potassium. Where was potassium supposed to be? Do you remember that from yesterday? Inside the cells. And now you have a lot of it outside. And that will stop your heart. In fact, that's one of the drugs that we give when someone is being put to death through lethal injection. We push a lot of potassium and it will stop their heart. We do not muck around with potassium leaking out of cells. That is a very life-threatening situation. Potassium is my least favorite electrolyte because of its complexity. You will hear about it many times throughout the summer semester, and I bet you'll learn to hate it too. But it's one that we have to deal with clinically all the time. Let's see. Eventually, the body gives up on trying to even cool someone. So they won't even they'll stop producing sweat. What about hypothermia? The usual suspect is that you've been thrown into cold water. That's the usual suspect. We can go back and think about the victims of the Titanic tragedy. They were submerged in water. They could not generate enough heat to overcome them being submerged in this big bathtub of cold water. They froze to death. What would you do if you were in cold water? And by the way, 80 degrees tropical water is still cold compared to your body temperature. But what would you do? Wouldn't you try and get small in the water if you had others around you? Kumbaya, we got to start cuddling. Even if you weren't submerged in water, if you were lost somewhere in a mountain, snow-covered mountain, you want to start getting more body warmth shared between multiple individuals. What would you look like? You start getting sleepy. And in fact, this is kind of morbid, but one of the ways that I had to euthanize mice, newborn mice, they were too small for me to do cervical dislocation, snapping their neck. Baby mice, they're tiny. How do you grab their neck to snap it? And I couldn't decapitate them because I'd probably cut myself. They're so tiny. One way that we would euthanize them is just put them in the freezer. Oh, stop. Everyone's like, oh. Yes, PETA, come after me. I don't care. We put them in the freezer. They would just go sleepy sleepies and turn into little mousicles. Yeah, you just get very sleepy, you fall asleep, and you don't wake up. So one semester I asked the class, I said, which way would you rather die? It's a hypothetical question, just so we start out with that. Which way would you prefer to die? Hyper or hypothermia? There's no right answer. Understand that. I'm just asking you a morbid question to get some class discussion. I know how I'd want to go. I'd want to go sleepy sleepies and just freeze to death. That's me. That's me. There was someone in the class who he was not right. He didn't last. I didn't add him to the class he was trying to add, and he was, creepy. And when I said, I know how I want to go, I would choose hypothermia. That's just me. And he went, clearly no. And I went, oh, okay. He said, burning to death is the better way to go. I went, wait, time. Where on here do I have burning to death? Yeah. Yes. Oh, there's more. I'm going to write a book. That's a great question.
I just was wondering if somebody had that.
That is a great question, and I can't answer that. No, seriously, here's why. Here's why. Some people go off to trips or do things, and they don't intend, hey, I'm going to get lost on a trail and just have the sun beat down on me and be unprepared. No one goes out like that saying, I'm going to just be unprepared and here's hoping everything works out right. I mean, they just found that woman who went for a little hike in Hawaii and was gone for what, 17 days? She did not go out prepared. Bad things happen. So there is a TV show called I Shouldn't Be Alive. Have you heard of it? And it's these horrific circumstances where multiple people died from the same environment, same exposure, but some person in the group lived. Hence the title, I Shouldn't Be Alive. It begs the question, why didn't they? We can make the argument, was something different in their physiology? Was the person who was exposed to cold temperatures already in a hyperthyroid state? I mean, we can ask these questions. Was there something about them that helped them a little bit more, gave them an advantage that somebody else in the group didn't have? When it comes to being exposed to high temperatures and heat, were they better hydrated than others before they went out? That is the reason why I cannot answer your question. Which one is faster? There's only one way to do that empirical test, and I don't see anyone really signing up for that challenge.
Just do like that at home, just mess around with the dogs.
Mess around with the dogs, yeah. I mean, we could, but I don't know how to answer that question.
I had this happen to my brothers.
Okay, time out. Yes. Hold on. When that story starts like that, I have to jump. Are they still alive?
Yes, they are.
Okay, good. Okay, then proceed.
It was last summer when it was like the random 118 degrees outside, and it was very humid last summer before the Legion fire. They were out on a trail in Corona area, and they got lost. And thankfully, they had like 1 bar of cell service, but on the iPhone, they were out gone for like 3 or 4 hours with no water, nothing. And from the iPhone, you can actually send a helicopter to where you are. And an emergency service team actually airlifted my brothers out from the national forest they were hiking in, and they were able to make it out.
And then the bill was delivered through the iPhone as well.
They didn't ask for anything. The person that used it didn't get a bill at all.
Really?
Weird. Yeah.
Someone paid for that.
Yeah, somebody did. Yeah.
Wow.
But it's a fun story.
I still will not get an iPhone. I refuse. I refuse. No. That's a different story, though. Well, I'm glad brothers.
I have 3 brothers.
And all 3 were together?
Yep.
And so it's you and these 3 brothers?
I wasn't there.
No, I know that.
Yeah.
I'm just doing the inheritance calculation if they had gone away. Okay, that's what I was saying. I'm glad they made it.
I love them, but that would have made my life a lot easier.
Try and be We all have one. We all have one in the family. And some of you are missing someone because the rest of us have more than one. Time to pick up yours. I do understand that statement. Yes. Should I edit that? Your face isn't on there. It's okay. Going on to another thermoregulation problem. I love this class. Let's talk about pyrogens and fever. A pyrogen can be something that you have acquired, something that has invaded you from the external environment. Of course, I'm talking about viruses, bacteria, fungi, some sort of organism that's invading you. And pyrogens, pyro, fire, ogen, to start a fire. These external or extrinsic pyrogens can alter your body temperature, and I'm going to explain how. There are also internal, endogenous pyrogens, and Guyton and Hall gives you a whole list of external and internal pyrogens, and I really don't care. I just want you to know an external, exogenous pyrogen is your classic usual suspect. Bacteria, virus, some other microorganism that is going to muck with your normal physiology. That's an interesting story right now. Does anybody keep up with the news? The couple from Texas that died in Fiji. We're going to figure out how. They're saying some sort of super flu, some sort of influenza. Did you read about that?
I know that it happened, but I didn't hear anything about what
they're still trying to figure it out. So she died first, and then he died while they were trying to airlift him to Australia. I would pay attention to what's happening over there, because whatever is on that island, I hope doesn't get off. I'm reading about that one. Endogenous pyrogens, something that comes from within that can alter your set point, making you warmer. Remember, pyro, fire, to start, making you warmer. And now, about now, a student will say, well, why would something within your body want your body temperature to get warmer when, Kara, we just talked about getting too warm could have lethal consequences? You're right. Within reason, elevating your body temperature could actually be an advantage to you, especially for your immune system if it is trying to fight an exogenous microorganism that has invaded you. So we have exogenous and endogenous, external, internal signals, chemical signals that can alter our body temperature, making it warmer. When this body temperature is altered, how does that happen is the question. Our set point is altered. How many of you are too cool right now in this room? Okay, let me alter the set point. Where did I go? The thermostat. That's my integration center. I now raised the set point. The air, given about 15 minutes, will not blow as much in this room. And pretty soon, the same people that said it's too cool in here, they will be outmatched by the rest of you going, now it's too blazing warm in here. So we're going to experience how that set point will elevate our body temperature in this room. So that is, of course, what the definition is of a fever. A fever means your body temperature has gone up because your set point has been elevated. That's an important distinction. The term hyperthermia is merely a generic term to say your body temperature is too warm. That's it. Period. End of story. But if I say you have a fever, now I'm saying two things. You have an elevated body temperature and it was caused by altering your set point. Steve.
So is that term hypopyrexia just a fancy way of saying fever?
Yes. Absolutely. Yes. What's your name again?
Josh.
Josh.
Why isn't this mechanism a response to hypothermic type of situation? Like, why can't the body just get itself a fever if you're stuck in it, like cave or something?
Can you say that again?
If you're cold, and the mechanisms of that are shivering, muscle contraction, vasoconstriction, and the other things, why isn't fever one of those mechanisms?
To actually alter your set point to go up higher, yeah. So to provoke even more
I guess, yeah, that would be a
shiver.
good. So, but we're doing all these things to warm the body.
I understand now what you're saying. So understand that your scenario started with our body set point is already 98.7 degrees. We're in an environment where now the environment is making us too cold. Our body will start to compensate, try to, whether or not it can outmatch the environment and warm us up to our set point is a different question. Will we be outmatched or will we be able to warm up sufficiently? But your brain isn't going to say, oh, I know, let me go up, let me change the set point to 105 and really rev up the systems. There is no need, because now a really high temperature can have deleterious outcomes as well. I will hopefully be able to tease apart your question better, Josh, if you just give me 15 minutes. Okay? I understand your question now. Short answer, that's overkill.
No, it's not beneficial.
No. Could have bad outcomes. Now you're swinging hard too far this way. And you might not need to warm up that much, right? We want 98.7. We don't want to get to 105. There is a condition called, side note. Okay, so please do not memorize this flow chart. It is basically giving you an example of exogenous pyrogens invading your body. They have their own chemical signals that can go to your brain, and I'll act that out for you in a moment. But your macrophages, being part of your immune system, they too have their own chemical signals to tell the brain, the hypothalamus, hey, we're under attack. Please give us a leg up. We can beat these invaders. Is your hand up or are you just playing? Okay, that's okay. Keep playing because it makes me feel soothed. Yes.
So in the hospital, when a patient has a fever, we were told to put ice packs in the groin, under each arm, and behind the neck. But you were talking about earlier that lukewarm is better.
I said submerged in a bath.
Okay.
Those are distinct points, and the person is not submerged.
Okay. So that's okay that way.
But we're going to talk about that. We will. Okay. Whew. I'm earning my money. Day 2. There is one chemical signal I do want you to be aware of called interleukin-1, IL-1. This is an endogenous pyrogen. It is released by your immune cells, specifically macrophages, to use the example on this slide. And interleukin-1, when it's released by your immune cells, circulates through your bloodstream, and it will get to the part of your blood-brain barrier where there is some leakiness. And in this area where there's leakiness, and don't worry about this abbreviation, it is basically right, do you remember in anatomy was a prereq? Do you remember the sella turcica, part of the sphenoid bone? The pituitary sat in the sella turcica. The pituitary is connected to the hypothalamus, which is just superior to it, through a tiny little stalk called the infundibulum. Your meninges wrap around that stalk. And that is where your blood-brain barrier is a little leaky. It's not sealed tight as well as you might think. So that's the area that this part of the slide is talking about. This interleukin-1 percolates through your body, gets to this region, and can actually go from the blood and enter the hypothalamus. And interleukin-1, if it could talk to you, hence me saying, Josh, that I'll act it out, it might say this. Hi, hypothalamus. You don't know this, but down in the body, we have some invaders. We're aware of them. We're on it, buddy. Don't you worry. But, hey, could you just elevate the set point just a little bit? Hypothalamus says, sure, I'd be happy to oblige, but why should I do that? And interleukin-1 says, well, turns out that having a slightly warmer temperature means that the enzymes that are found in the immune cells, especially macrophages and neutrophils, work better, faster. And that means we can get rid of those invaders even better before they overcome us. Hypothalamus says, well, since you put it that way, of course. And interleukin-1 says, not too much, though. Not too much. Too much, you'll kill us all. Just a little bit, just to give our enzymatic reactions a leg up. Now, that is not going to be a new concept for you in about 4 weeks, 3 weeks, when you learn about chemical digestion. You will learn that enzymes that we use to break down our food are also temperature sensitive. Warmer, they break down the food faster within reason. Colder, they slow down. So in this case, having a low-grade fever is actually helpful to us, and that's part of the reason why when parents are nervous and they call the doctor saying, my child has this fever, what's the first thing they want to know? How high is it? And if it's around 101 or so, they're probably going to say, just watch the child. Keep them comfortable, but they frequently will not recommend giving Tylenol or some other fever-reducing drug because we know the low-grade fever can have beneficial effects. Let the body heal itself. Now, but if it's an exogenous pyrogen that gets to the brain first, yeah.
So for our body to produce fever, it has to be we have to be like infected or invaded by like microorganisms. Otherwise, like the endotoxins won't be released.
That is a great question. No, you don't necessarily have to be invaded. We can actually have an inflammatory response, and that also can provoke a fever. So for example, tissue damage can provoke an inflammatory response, and we can still get a fever from that. It does not necessarily mean that we have a microorganism.
Oh, you mean like by getting a cut? Like a scrape or something?
A scrape, sure, a scrape.
So, I mean, if you get a scrape, not necessarily you get a fever, right? Unless you get like infection or something.
So, for example, what if you are allergic? Let's just do, you're allergic to something. Not something you ingest, something you touch. Okay? And you break out in this rash. Part of the inflammatory response will be where you touched it will get warm, won't it? But also, if your inflammatory response is pretty big, you could develop a fever. You could. Slightly higher temperature means more movement of the immune cells to the area, but also higher temperature lets them fight whatever it is they're fighting, part of this inflammatory response, better. Okay. Working. Okay. Exogenous pyrogen. Exogenous pyrogen. Bacteria, some of them can bleb off some of their bacterial components. How many of you have taken micro? Because I don't want to scare you too much if you haven't. Okay, so not everyone, but most of you. Okay, some bacteria have a substance called, for example, lipopolysaccharide. And they can bleb this off of them, and it goes also through your bloodstream, and it too can cross the blood-brain barrier. And now, if I were to act it out to you, it'd be, hi, hypothalamus, we're new here. Yeah, we just moved into the area. It's a little cold for our taste, though. Would you be so neighborly and just kind of increase the temperature a bit for us? And the hypothalamus says, sure, this body is so neighborly. Of course, welcome. And so the set point goes up. And if your set point goes up, your current body temperature is now perceived to be what? A deviation. It's too low. And what will you do? You will start to shiver. You will vasoconstrict your blood vessels. You will look pale to me. You will get very small. And all of a sudden you're asking for blanket after blanket after blanket. You have a patient that says, I'm so cold, I'm shivering, I need more blankets. Check on them in 20 minutes. That's the time course of a fever. They start to complain, give them 20 minutes. Check on them, bet you they have a fever. You've probably felt that malaise hit you. Have you ever just talking, and then all of a sudden, you know that? I'm getting sick. I mean, it just hits you, right? And it's another part of your brain going, red alert! Start something now. The problem is, if it's exogenous, it doesn't obey regulation. There's none of this within reason. There's none of that. So you start to shiver, your body temperature goes up, and if that lipopolysaccharide is still being blebbed off of this bacterium and your immune system isn't knocking it down, that lipopolysaccharide goes back to the brain. Hi, well, you know what? That was so kind of you. Still a touch little cold. Can you elevate it again? And now your body temperature is no longer a low-grade fever. Now you have a very high fever. And this is dangerous, yes.
Would that be an example of a positive feedback loop? So the set point went higher, and then
more lipopolysaccharide leading to an elevated body temperature, leading to more shivering. Yes, if your infection is great enough, yes. And that is where positive feedback mechanisms can become deleterious. But please understand, I will never use a viral or bacterial infection as an example of positive feedback mechanisms. It will never be an answer choice. Because when we're talking about thermoregulation, negative feedback is what controls our body temperature. If our body temperature is failing to be maintained, then the proper way to say that is we have negative feedback failure. Negative feedback failure. Okay. How exactly does the interleukin-1 and this lipopolysaccharide actually alter set point down to the molecular level? How does that happen? Up at the top here, you see the cell membrane. But what cell membrane? the cell membrane of a hypothalamic cell, a neuron in your hypothalamus. Embedded in the cell membrane are receptors, those blue ones. Draw a little line saying receptors. They will bind to these substances called pyrogens, interleukin-1, lipopolysaccharide, just to use the two that I gave you as examples. When those receptors are bound by those pyrogens, a phospholipid tail is cut off from one of the phospholipids. Do we all remember what a phospholipid is? They are those water-loving heads and then the fatty acid tails that you're seeing. One of those fatty acid tails is cut off, cleaved off. Now it's floating in the cytoplasm. That fatty acid is called arachidonic acid. When arachidonic acid is now floating in the cytoplasm, there is an enzyme called COX, cyclooxygenase. There are different kinds of COX enzymes. There is COX-1, there is COX-2, there is COX-3. And the fact that there is more than one variety is actually clinically important, and it will take me a while to explain to you why. But this will not be the only day you hear about COX. So COX-1 in particular, is going to work on this arachidonic acid in your hypothalamic cell. And COX will shunt the arachidonic acid into various pathways that you see here. Do not memorize them. So this fatty acid goes into these metabolic pathways. It will be morphed into something called a prostaglandin. Now it turns out that prostaglandin E2, down here, prostaglandin E2, when its levels go up in this hypothalamic cell, that is the molecule, when it goes up, that the hypothalamus says, oh, our set point has gone up. Just like I went and pushed on the arrow buttons on the thermostat, going up, when PGE2 levels go up in the cell, so does set point. When the set point goes up, your current body temperature is now perceived to be too cold. That is a deviation. What will you start to do to warm up? Shiver, vasoconstrict. You get small and you put on layers. What do you think would happen to your set point if we reduced PGE2 levels? If set point goes up when PGE2 levels go up, what will happen to set point if PGE2 levels go down? Good job! Now, what is it that can lower PGE2? Well, one way to lower it is to block its synthesis. Does that make sense? Don't make as much of it. Don't make as much of it, and the PGE2 that was already made, with enough time, it degrades. Things go bad in your refrigerator. Things go bad in your body, too. They degrade. So how can you block the synthesis of PGE2? Block the COX enzyme. Block it. And in fact, you take medications that are COX inhibitors. And if you're falling asleep right now, I am not talking about a condom. That's a different COX inhibitor. It's something else. It never gets old. You call that Tylenol, ibuprofen, Advil. Those are all COX inhibitors. So if you take that drug and you block that enzyme, then you will not make as much PGE2. Then the PGE2 levels in your hypothalamic cells will go down. Then your set point will go down. And now your body temperature that's too high is now perceived as a deviation. And what will you do? You kick off the covers. You vasodilate. You will have a flushed face. You will start to sweat. And when we look at you and we see that, we say, oh, your fever is breaking. Don't we say that? Well, ancient physicians, when they saw their patient turn that corner, they called that crisis. Crisis was a pivotal moment in their patients. They either were going to die or they were going to get better. And so when they saw the flushed face appear in their patient, they said, oh, we're at crisis, and it looks like they're going to get better. Crisis to us means like a bad thing, like, oh, they're in crisis, this is bad. No, for ancient physicians, it was a pivotal point. So these, go ahead, Stephen.
Well, I was just saying, so I just want to make sure I was understanding it right. So you were saying when we start to break our fever, that is signs that we've done away with or that we've at least limited the production of that exogenous factor.
No. We haven't limited the production at all of whatever pyrogen. What we are doing is inside the cell of the hypothalamus, and we are blocking the COX enzyme.
So basically your body is recognizing this problem and producing these antipyretics or COX inhibitors to block that and get you to that point where your fever starts to break.
Fever starts to break. So look, here, are you a parent?
Hell
Okay, good. Do you watch Family Guy? Okay, Stewie. Mom, mama, mother, mother, mom. My kids, when they were little, same way. They can bark at me all they want. Yeah, I have a glass of wine in my hand. I can't be bothered. Think of that as my COX inhibitor. Does nothing to them trying to get my attention, not doing anything to the signals that they are giving off. Mom, mama, mom, mother, mom.
So it's like a door lock for the hypothalamus when that stranger comes.
So the signals are there. The receptors are still bound, but intracellularly, that cascade of event is blocked. The enzyme that starts the prostaglandin synthesis is blocked. Yes.
So what happens when like the Tylenol or the wine wears off?
You get more. Yes, that is frequently why when we feel sick, we're taking multiple dosages throughout the day, aren't we? Yeah. They do wear off. Now, COX enzyme, it's an enzyme. Most enzymes are products of gene expression, right? Yeah. So there are certain COX enzymes that are permanent inhibitors. They're like poison to the enzyme. And they don't come off. So you have to make new enzyme. That's gene expression. It's part of the reason why we talked about it yesterday. So the medicine wears off when your gene expression makes more COX enzyme that is now responding to that signal. You take more of the antipyretic COX inhibitor, and then that one goes sleepy, sleepy.
Then you just keep going down that cycle.
Until your immune system goes, let's eradicate whatever is causing this. Or we have eradicated, we don't need to tell the hypothalamus to keep this low-grade fever anymore. Yes, Kira?
So that's what happens when fever breaks naturally, the signals decrease.
Right. It could be that our immune system has fought off that microorganism that has invaded us. Yes, great questions. So, antipyretics. No one goes into the pharmacy saying, hey, where are your antipyretics? Where are your COX inhibitors? But won't that be fun from now on to use that language? I'm going to the store. Do you need anything? Yes. Could you get me a COX inhibitor, please? A what? I will not buy you that. It's an antipyretic. What? What do you, I love starting to use the language, right? And no one knows what you're talking about. Careful, you won't be invited to parties, though. So we talked about the possible advantages of a low-grade fever, but a high fever is not an advantage. We start to get the rhabdomyolysis, the potassium imbalance, that's lethal. The time course of a fever is about 20 minutes. That's about how fast your body temperature can spike when your set point has been altered. In children, it can be so quick that they can have febrile seizures, and that's very scary. So here is our time course of a fever. We have down here in red, that is your current body temperature. That is your body temperature. The blue dashed line represents your set point. Down here, the beginning of your day when you felt good, your set point and your body temperature were practically even matched. You were in normal, healthy range. Then you had some sort of pyrogen bind to receptors on your hypothalamic cells. COX enzyme was stimulated and your PGE2 levels went up. What happened to your set point? It went up. But your current body temperature is still down here. Here's your set point. Here's where you are. You are now, your current body temperature is perceived by your brain to be a deviation, and we must correct that. You start to vasoconstrict, you start to shiver, your hair can even stand up on end. We are not hairy organisms like a bear, but when our hair stands up on end, we get goosebumps. That's called piloerection. In furry animals, this helps trap more heat closer to their body, but for us, not so much because we're not very furry. Eventually, your body temperature will rise and you hit that new set point. An elevated body temperature, though, can be deleterious. It can lead to rhabdomyolysis. It can lead to the regurgitation, if you will, of potassium into the bloodstream out of the cells. We would like to ameliorate that if our body temperature is too high. We take a COX inhibitor, an antipyretic. We block COX enzyme. Then that means our PGE2 levels go down. What will happen to our set point? It goes down. And now our current body temperature compared to our set point is too high. That is a deviation. What will we start to see? We will see the blankets come off. We will see sprawling. We will see sweating. We will see the flushed face. And that's what the ancient physicians used to call crisis. Is that good? So, fever is a specific kind of hyperthermia. Let's talk about exercise-induced hyperthermia before we have to go to the lecture part of our class. Does anybody here go to the gym or work out in general? When you work out, does your body temperature go up? What do? You start to sweat. Next time when you're working out, I want you to say, wow, I'm experiencing hyperthermia, but look at this. My body is able to compensate. No one leaves the gym, leaves their workout going, feel me, I have exercise-induced fever. We don't go to the gym and develop a fever. If we did, arguably that'd be another reason not to work out. Keep track, I'll give you a lot of them as we go through the semester. But you do get hyperthermia. You do get warmer. That's because you're moving around and you're generating more body heat. But your set point has not been changed. It has not. You have not released interleukin-1. You have not had bacteria release lipopolysaccharides in you. You have exercise-induced hyperthermia. And if we go to the graph that I just showed you for fever, what would it look like? Again, the dashed line represented your set point. The red line represented your current body temperature. What would that graph look like? Do you have a red and a blue pen? What would it look like? I'm going to use Dr. Shaw's technique. I just remember. I know, you're so smart. Not too much. You go to the gym. Does your set point change?
No.
No. So that's your blue dashed line, right? So what does that look like? Not that you would work out for 5 hours, but if you did, your set point would not change. But what happens to your body temperature as you're working out? Of course, that's going to go up. Will it keep going up? Do we get up to 105, do you think? No, because what starts to happen? You start to deviate. Your hypothalamus says, what in Sam Hill are you up to? What are you doing? Now we're getting too warm. And what will the hypothalamus now do? It's going to send outgoing commands to your effectors. And it's going to try and cool you while you're working out. You start to produce sweat, don't you? And if you showed up in a sweatshirt, what do? You're probably taking that off, aren't you? So eventually, your body temperature plateaus because your compensation is matching your workout effort. Now you're done working out. You race home because you can't wait to get to physiology and learn more. You hurriedly get in the shower, dry off, get dressed, jump in the car, only to find yourself drenched all over again. Has that happened to you? Why? Because your body temperature is still elevated even though you're not working out anymore, and your hypothalamus is saying, you're still too warm. I still need you to sweat. And you will still keep sweating until our body temperature comes back to where I want it to be. Stephen?
So just remember the term cool down period. If there was a change in your set point, there would be no cool down period.
If there was a change in your set point, there would be no. Are you saying if my set point went up, there would be no cool down?
If your actual set point changed while you were working out, then your body wouldn't cool back down to the original set.
Not unless the set point came back down before that, right? Okay. Good stuff? All right. I'll see you over in the other room in about 7 minutes.